Good afternoon. My name is Alexis Pleus, and I want to first thank all of you for exploring alternatives to incarceration and for an invitation to provide testimony today. We're grateful for our state lawmakers who have recognized that our state is overly incarcerated and for seeking alternatives to end mass incarceration to work towards a healthier New York. Truth Pharm's primary office is located in Broome County, and we have many of our own incarceration issues, including having the highest incarceration rate in New York State. We also have 75 to 80% of our incarcerated population they have not been convicted of a crime. And we have more than twice the national rate of disparities for arrest of people of color versus white people. And our county has only about 5% people of color, and we have a gross disparity there. Our jail also has 6 times the national average death rate for a jail of its size, and I know that Assemblyman Weprin is very familiar with Broome County because many of our organizations have met with you multiple times, and you've introduced a bill to oversee incarceration, and I appreciate that as well.
Yes, I love Broome County.
Thank you. We don't love these issues, but we like Broome County. Our issues also include an overzealous probation and parole department and longstanding unnecessary practices, such as assigning 3 years of probation every time probation is assigned, even when that's not necessary. Our alternatives to incarceration programs include drug court and then several loosely defined programs by our district attorney, most of which are not accessible by people of color in our county. We had a person who sat in on a drug court for about 9 months and only saw 2 people of color in the entire time of our drug court, even though we arrest people at a much higher rate, people of color. So we are not having those services accessible to people of color. Furthermore, our drug court, like many drug courts, overly uses jail as a punishment and for sanctions for any sorts of issues, such as appearing late to court or appearing late for drug tests. And I have one example, a gentleman named Rob Card this past year was in drug court performing well according to their rules and standards, and he was diagnosed while he was a drug court participant with a brain tumor. He was then required to attend multiple doctor's appointments, multiple testing, things like that. His life was becoming very encumbered with medical requirements. He came late to a drug test, about 5 minutes late for a drug test. The drug court judge remanded him to jail for coming to his drug test late. He was remanded to our Broome County jail, where he was not provided his medications that would keep him alive and seizure-free. His health deteriorated while he was in jail, and it only took 13 days for them to remove him from our jail on a gurney, lifeless. He completely lost his life as a result of being remanded to jail for being late to a test for drug court. Drug courts, electronic monitoring, and other punitive approaches for pretrial services defeat the purpose of New York State's outstanding criminal justice reforms. While district attorneys, police agencies, and county sheriffs scramble to secure their place in the world by speaking out against these reforms, those of us who are in support of these sweeping reforms must ensure that the proper services are in place to safeguard the desired outcomes, as many have mentioned today. These should include voluntary services offered to all persons released on their own recognizance and a broad range of methods to remind participants of upcoming court dates. We must return to innocent until proven guilty with great commitment. Truth Pharm has developed a pretrial services program, which Deanna mentioned, and it utilizes a tool that's already been created under a DSRIP Medicaid redesign program that also assesses social determinants of health. We're very familiar that many people who commit crimes do so as a result of not having their basic needs met. We had a person in Broome County Jail who was there because they stole diapers for their infant. And so obviously their basic needs are not being met. If we could meet those, we might have less people incarcerated. So the pretrial services program that we've developed is based on a health improvement program, which is showing great success in Broome County. But our Broome County officials are opting to use the probation department to carry out the pretrial services for budgetary reasons. We're happy to hear the earlier probation officers mention that they are not equipped to handle these pretrial services, and we would certainly like to keep it that way. Our probation department's experience working with people is post-conviction, it's punitive in nature, and it's not service-oriented. This approach maintains the status quo, assigning an agency that is intended to monitor, place restrictions on, and punish people. We are hearing that many counties in upstate New York intend to do the same, again, as we heard earlier, which is really troubling. I've attached a lot of references and information for your use. I just want to mention that based on a lot of research that has been done, it's shown that community-based organizations are the best organizations, as also mentioned here on this panel, to handle pretrial services. These are people who are invested in the outcomes of the people who they are serving, which is a little bit opposite of probation departments. And I wanted to mention jurisdictions must guard against imposing unnecessary mandatory conditions, as Deanna mentioned, such as drug testing and treatment, mental health treatment, and electronic monitoring, as they can also be disruptive to people's lives, their family lives, and their employment. Research has not shown that these requirements improve pretrial outcomes. Santa Clara County is also included in the testimony that you have copies of. They have a community-based program that includes churches, as also mentioned earlier, and other community-based nonprofit organizations, and they help with reminders to return to court, but also transportation. And transportation, as mentioned earlier, in Delaware County, Broome County, Shenango County, Tioga County, all of these rural counties don't have public transportation modes. People a lot of times don't return to court because they don't have a way to get there. And so including those types of services and pretrial release services would be a great help. The closing paragraph of that Santa Clara County model, it says, this model of conditional release can help to engage the broader community in pretrial justice and can lessen some of the workload for a pretrial services agency while also tailoring pretrial support for a particular individual, which is really important. There's no blanket that's going to fit for everyone. The model provides access to health assessments, as in the model that Truth Pharm has developed, medical services, as our model does, public benefit enrollment, social service referrals, job referrals, legal services, and educational services. And these are all extremely important, and that's what we've been advocating for. Based on our knowledge of how Broome County's probation department functions, we find it hard to believe that they will be able to carry out pretrial services in the spirit of the laws that you've passed. And they play a large role in the over-incarceration of our county, and our county is certainly not unique. And I want to mention another young man who just this month died in our Broome County jail. So another one added to the list. And he was a young man who has not had any new convictions in 3 years. He's been on probation for misdemeanor traffic violations and a minor marijuana possession charge, has not been in trouble for 3 years. He also has a medical condition, and he was hospitalized for that medical condition in October. He didn't make his probation appointment because he was hospitalized. When he was released, he was informed that he had violated his probation. He showed his hospital discharge papers. He was violated anyways and remanded to jail. 21 days later, he was removed from our jail on a gurney, lifeless. The only service left to give him was an autopsy. And that is what's happening in Broome County, and that's that death is on the hands of our probation department, in addition to the jail, in addition to the judge. And we have to continue to try to avoid these issues. Unfortunately, I could continue telling you about 9 additional deaths in our Broome County jail over the past 8 years. Meanwhile, the rural counties surrounding us have similar issues, even if not as severe as our own, with national studies telling us that at least 63% of United States prisoners have substance use disorders, and another study telling us that incarceration increases a person's risk of fatal overdose by 40 times for the first 2 weeks post-release. We must do all we can to keep people in the community and offer them whatever services necessary, rather than increase their risk of death through incarceration or forced treatment. Our criminal justice system is not only punitive, but it's deadly, and it is far from corrective. We must do everything we can to ensure that people can remain in the community, obtain the services they need, and that pretrial services be provided by community-based organizations who work to serve and support individuals rather than punish. This will allow people to maintain their homes, jobs, family, relationships, etc., while awaiting trial, as they should be able to do. Based on our experience working with Broome, Shenango, Delaware, and Tioga counties, most counties are not properly preparing themselves or ready to offer the least restrictive services as required by the law you've passed, nor have they engaged the services of community-based organizations to provide the services which evidence shows is the best approach for outcomes. I was also disturbed earlier when I was listening to other testimony. All of these comments that we don't have data, we don't have data, we don't have data. Yes, we do. Yes, we do. Yes, we do. New York State Division of Criminal Justice Services has all of the data that you're looking for on their websites, and those who are sitting here saying that there's no data to support what would be best, that's inaccurate. There's plenty of data out there showing us what would be best, and there's plenty of data showing us what each jail's population is, what crimes they were convicted of, and who will be released. We can get those numbers. They're attainable. And that's the difference between, I believe, a community-based organization and then an organization who's only put in place to serve one function. We're passionate about what we do. We're passionate about saving lives, keeping people healthy and safe. We'll do the research. We'll make sure that whatever is employed is proper and healthy for people. We would implore this committee to ensure that as these reforms are implemented, that the state play an active role in ensuring positive pretrial services are put in place in each county to ensure we achieve the desired outcomes. Poorly run, punitive pretrial services have the potential of harming individuals and damaging the chances of long-lasting reforms, which I think was your closing line as well. And when we talk about funding and we're looking for funding, we keep ignoring the fact that we should be reducing our jail population by about 50% across New York State with these reforms. There is a lot of money that will be saved there, and that money should go right back into the community, right back into pretrial services. The money is available if we make sure that we redirect those funds. Thank you very much.
Yes, thank you, panel. Thank you, Ms. Pleus. Unfortunately, the incident you cited in Broome County with the particular individual being late 5 minutes and the tragic circumstances happens in other parts of the state as well. And we're working hard to deal with those issues of people that are being remanded to prison or to state facility for minor, and I quote, minor probation and parole violations, and that's a problem, and that's something that we're trying to combat and deal with, because I hear this over and over again about minor infractions when someone's out on parole or probation, and then they return, and then all the problems start again. So we're very much aware of the issue. We're going to work on that, and as our prison population is reduced, we'd like to put some of that money that's being used in the facilities to alternatives to incarceration, to programs in the community, and that is a good suggestion to provide funding with the money that we're saving by reducing our prison population. Thank you for coming. Any question?
Thank you, Mr.
Ms.
Chairman,
Walker?
and thank you for your lofty and very informative testimony, and also for your willingness to help sort of figure out a number of the dynamics that we're under here. So one of the points that was made, though, I am totally not sort of doing their bidding. However, one of the points that was made by the probation panel that was up was that they don't have the, I guess, pretrial services or community-based organizations that exist within their counties. Is there, are you aware that there are counties that don't offer any of these services presently?
So we function in Delaware County, which one of the probation officers was here, one of the probation officers here
Right.
earlier was from Delaware County, and Truth Pharm operates in Delaware County. The problem is that no one has invested in those counties in pretrial services. So, when they say there's pretrial services don't exist, there's no actual structure right now to refer people to pretrial services. There are agencies, community-based organizations, and nonprofits who are already serving those people, just not as a function of the flow of the court system now. And we're hoping with these new reforms that will change.
So have the Office of Court Administration perhaps reached out to some of the nonprofit organizations, since you are one of the authorities that are listed to handle this work? Are you a part of the conversation, at least?
We are, but we've had to reach out to them. It's not quite the other way around.
And what has that response been like?
So they're leaving it up to the counties to choose where they want those services to be delivered. And so in our county, in Broome County, they're just simply stating it's going to be easier for them to use their probation department and add 1.5 full-time equivalent probation officers to their department to deliver the services. And, we heard that earlier also for Delaware County and Warren County. So my fear is that that's the direction that a lot of counties are going to go in, is having it, right within their probation department, just because it's easier, not because it's healthier, more appropriate, or better for people. But yeah, those are the answers that we're getting as of now.
So are there opportunities that are presented with perhaps some of these local government agencies to partner or contract with some of the groups on the ground in order to administer some of the services based on their shortfalls?
Yeah, we hope so. So right now, the county is saying right now, they just finished their budget process. They can't say what their savings might be this next year by having a lower jail population. So they said they didn't have it in their budget to use community-based pretrial services. If I could find my own funding for the pretrial services, they would allow us to offer those services in Broome County, but I would have to go out and find that funding. They said next year, if we see a savings from having fewer people incarcerated, they might, and if probation isn't operating well, they might reconsider and then put out an RFP for pretrial services.
So
but this year, we're kind of in limbo, I think.
Right. One of the, so we've posed this question also to some of the individuals in the city of New York in terms of how it is that they're looking forward to handling the financial resources to support bail reform. And from what I understand, it's the city of New York that is going to be supportive to the district attorney's offices with respect to the implementation. So is there perhaps another maybe local city sort of government agency that may be able to come in to be supportive of some of the work that you do and they are able to continue to do on the ground?
We're looking. We hope so. We haven't found the funding yet, but we are still trying. Yeah, and I don't know if you have similar.
Well,
I can't pull.
From her testimony, she sounds like the Oprah Winfrey of funding.
Well, I can't. So the sad thing is, I think the issue is, is the upstate counties are not as rich as New York City. So New York City is projecting ahead and putting funding out there now for expansion. But I would encourage the state for people to say that we can't estimate how much money you're going to save, but you can estimate maybe 50% of the money you're going to save. And you should really look at who's already on the ground doing it and empower them to even do, an initial program, a supportive program, so that, because what's going to end up happening, my fear is, with all due respect, I have a good working relationship with probation, but probation is a different arm of the puzzle, and it's not community-based, and we have excellent pretrial services, really, you know, it's not the same thing as community-based agencies that have been doing it for
Right.
decades in that community. So I feel like, you know, I feel like there could be money found. It's an easy math equation, and there must be a rainy day fund. It's kind of like, you know, your grandmother saves up money to do something special. Nobody buys Christmas gifts with their this week's. We have it from our savings account. So I just kind of feel when people are saying there's no money, I'm afraid that our communities are being set up for failure.
Right, so I'm just sort of, you know, I guess trying to maybe look at from some of the conversations that I've had with some of the other groups and some of the other locales regarding how they're going to be implementing bail reform. So just, you know, just trying to figure out, you know, wherever else that resources can be found, as we heard from some of the earlier testimony, that pretrial services is not just criminal justice in nature. It's housing, it's workforce development. And to the extent that there are some of these other tables that organizations will be able to pull from in order to address a dual need, you know, I look forward to definitely working with you in order to really make this a huge success, because we've heard the chairman say that there are people who are committed to making this an epic failure. But you know what? That's the story of my life. You know, a little girl growing up in public housing in Brooklyn, and I like to show that I'm not an exception, I'm an example. And it's the same way that I feel, you know, about this program as well, that it's really going to be something that we are all able to be extremely proud of. So I want to congratulate you on the work that you're doing, and also to just note that the suggestion or recommendation that's being made here is that the pretrial services that are afforded are services that are afforded through a community-based organizational model, as opposed to coming through a law enforcement
Good.
model.
Thank you.
Yes, thank
All
you
right,
so much.
thank you.
Thank you very much.
Okay, thank you.